According to the technical instructions for panel physicians issued by the CDC in 2009, all applicants must undergo a full medical examination, including the detection of pulmonary tuberculosis. The assessment consists of a complete medical history, physical examination, chest X-ray, when required, determination of immune response to antigens of AMP tuberculosis or PPD, and sputum smears and cultures for AMP tuberculosis when required. All applicants 15 or older require a full medical history, physical examination, and chest X-ray. If the chest X-ray shows suggestive data of tuberculosis, such as infiltrate or consolidation, cavitary lesion, poorly circumscribed nodule or mass, pleural abnormalities, mediastinal halar adenopathy, with or without atelectasis, fibrotic scar, discrete nodules without calcification, retraction of the lung parenchyma, or bronchiectasis. Or if the applicant shows signs or symptoms of tuberculosis, such as cough for more than 3 weeks, dyspnea, weight loss, fever, hemoptysis, or if the applicant is HIV positive or has AIDS. The applicant must provide 3 consecutive sputum samples for microscopy to look for acid-fast bacilli and perform cultures and confirm the presence or absence of AMP tuberculosis complex. The panel physician must provide the applicant the following information. An alteration has been detected in the chest X-ray and physical examination suggestive of tuberculosis, and this requires a sputum sample. Sputum must be collected on 3 consecutive days. Sputum must be collected exclusively in the morning during those 3 days with timeliness. And if one of those days is missed, the applicant must restart the procedure. The following day, after leaving his or her last sample, a preliminary result will be provided at the set time. The final result of the culture will be provided in 8 to 10 weeks. When the applicant arrives, trained staff ensures having all needed materials to take the sputum sample, such as latex gloves, N95 mask, gauze, resealable bags, sterile container, and a cooler with thermal control. Trained personnel goes to the designated area with the applicants that meet the criteria for the tuberculosis test, wearing an N95 mask at all times. Staff identifies each of the applicants through a valid passport. Also verifies that the applicants' names match the printed label on the sterile container where the sputum will be collected. And explains the procedure and technique that will be followed. Rinse your mouth with water and spit it out. Do not swallow it. This way, we will not get oral bacteria in the collected sputum. Relax and take several deep breaths while gently pressing your stomach with your hand. When you feel the urge to cough, You must inhale deeply until you feel it in your stomach. Once the sputum is in your mouth, deposit it directly in the container that was given to you. Get ready placing a gauze with one hand over your mouth and the other hand over your stomach once more. Cough as deeply as possible so you can really feel it in your stomach. Do not cough from your throat or with poor chest effort. If you are having trouble producing sputum, let the staff know. They can help you produce a sample. Give the container with the sputum to the staff, who will review the quality of the sample. Staff must hold the container against the light to ensure that you have provided a sample of good quality. If the sample is good, you are done for the day, but you must return for 2 subsequent days to repeat the procedure in order to complete the 3-day cycle. If you have provided a bad quality sample, you might be asked to repeat the procedure. Relax and try again. When you're ready, rinse your mouth once more and start over. This procedure must be performed in a facility with a functional sink, antibacterial soap, and a negative pressure or outdoors. Also, trained staff must clean the area after each procedure. Once this is verified, candidates for the pulmonary tuberculosis test should be moved to the designated area for sample collection, which meets all characteristics required by the CDC. The technical specifications set by the CDC to obtain a sputum sample are: volumes of sputum sample must be between 5 and 10 milliliters. Preferably, the sample should be obtained in the morning. Collect 3 samples every 24 hours on consecutive days. Samples must be obtained under direct supervision. Applicants must rinse mouth with purified water before providing a sputum sample. After staff accepts sample as of good quality, applicant can leave, but must be reminded that he or she must return the following day to repeat the procedure in order to complete 3 samples in consecutive days. Upon receipt of the sample and determined to be of good quality by qualified staff, the container should be sealed for transportation according to the technical instructions for panel physicians established by the CDC in 2009. They must be immediately transported to the laboratory. They must be individually packaged in resealable bags to avoid contamination or spillage. If they are not transported within the first hour after collection, they must be refrigerated or stored in coolers with thermal control between 46 and 59 degrees Fahrenheit. Samples must never be frozen. Ideally, samples received by the laboratory should be processed within 24 hours. The laboratory must examine the samples. If they are not acceptable, the procedure must be repeated immediately or the following day, considering the new sample as the first of the series. For those applicants that may have difficulty producing sputum, there are many ways to obtain an adequate sample. To stimulate expectoration, inhalations of aerosol of sterile saline diluted between 3 and 15%, usually produced by ultrasonic nebulizer, can be used. Samples may seem aqueous, however, they must be processed. It is very important to mark the sample as induced sputum so that it's not considered a bad quality sample by the laboratory. Laboratory personnel must consult the panel physician for any possible alternative method for obtaining sputum like bronchoscopy, gastric aspirate, or nebulization. It is important to remember that the applicant will receive a preliminary result after providing his or her third sample. The final result will be provided from 8 to 10 weeks, which is the established time frame for the analysis of the culture of M. tuberculosis.